Beautiful Beginnings. Have you heard about this? It's a home visiting program for new families offering safe sleep education, postpartum care, and more. Today we're joined by public health nurse supervisor Breana Francis to learn more about it and chat about Black Maternal Health Week. And later, when you're here, your family. We all have a favorite restaurant, whether they're healthy or maybe not so much. But what restaurant slogan sticks in your head the most? All that and more coming up on Health is Real. Come on in, stay a while. Andrew Stinson here alongside Angela Taw and Zach Watson. The name of the podcast is Health is Real from Franklin County Public Health. Coming to you today from Memorial Hall, downtown Columbus. Angela, how are you doing today?
Real good. Thanks for asking.
Wonderful. And Zach Watson, how are you? Wonderfully. Eager with the wonderfully. Love it. I'm excited for our guest today, Breana Francis, public health nurse supervisor here at Franklin County Public Health. Breana, how are you doing today?
I am good. Thank you so much for asking, and thank you for having me on here.
Absolutely. Thanks for coming. I guess just tell us a little bit about your experience and your career journey before you got here to Franklin County Public Health.
Okay. So I am a registered nurse as well, and when I first started my career as a registered nurse, I went straight into labor and delivery. I worked at local hospitals around Columbus and then also took a few travel nursing positions as well. I just really saw a lot of different things and challenges that I didn't like throughout the healthcare system. So I wanted to take a opportunity and a leap of faith and come over to Franklin County Public Health and see what drive I can bring here and what inspiration, motivation, and just things for our families.
Yeah, I think that's really wonderful. And you're over the Beautiful Beginnings program. So for
correct.
Someone who might not know what that is, right? Can you just tell us a little bit about that and what it is that you do or try and accomplish within that program?
So Beautiful Beginnings is a nurse-led home visiting program. It is ran by 3 public health nurses, including myself, and 2 community health workers. We primarily focus on minority, pregnant, and postpartum women, and we follow them all the way through their journey through pregnancy, and then we can follow them up until their child turns 3 years old. We really focus on things like safe sleep, breastfeeding, postpartum care. We call it the 4th trimester. And then also just really empowering and advocating for those families so they know what to say, what questions to ask, and not have any fears when they go into the hospital for anything.
That's awesome.
Yeah.
Well, I know also your program handles home visits, you know, for young families. Can you talk about what a typical home visit looks like?
Absolutely. So we can conduct home visits either on a monthly basis or as needed basis. And if they want to meet at their personal home, we can, or we can go to a public place, whatever is more comfortable for them. We really just want to support a comfortable, relaxed environment for them. So that way we can get to know them on a personal level, build a good rapport, get to know their families, and really get to know what unique needs each family has.
Wonderful. And I know the Beautiful Beginnings team has a focus of helping Black and African American communities. Can you tell us a little bit about that?
Absolutely. So I don't know if you guys know, but there is a huge health disparity within the Black and minority communities, especially when it comes to maternal and child health. Unfortunately, according to the CDC, since 2018, racial disparities and postpartum depression rates and symptoms have actually raised by 700%.
Ooh,
and that's throughout the United States, which means it's 1 in 4 women to report at least one form of mistreatment, judgment, or misguidance from a provider, which, if you think about, is really crazy. And during pregnancy and just that entire experience, it's a crucial time period for a woman to go throughout their lifespan. And just to feel that they're not supported, not listened to, or if the fear of going into the hospital, something may happen to them or their baby, is horrible to think about.
Yeah.
So We really just want to raise awareness and just really try to decrease those horrible morbidity and mortality rates in any way that we can. Bring awareness to the issues throughout the clinics, throughout the communities, and just any way.
Mm-hmm. Yeah, that's really awesome. And I know with the Beautiful Beginnings program, there's also, like you were saying earlier, like the safe sleep assessments,
Yes.
and like you guys have portable cribs
Yes.
potentially. Can you talk more a little bit about that?
Absolutely. So we partner with Columbus Public Health, and we conduct safe sleep assessments with our families. And if we identify that they need or they do not have a safe place for their infant to sleep, then we can provide them with a pack and play or a portable crib, completely free, no cost to them. We help them set it up, and we also help them take it down and just make sure that they understand the importance of safe sleep. Safe sleep is just, it's another big initiative that Beautiful Beginnings focuses on, because Black and minority infants also have a higher rate of sudden infant death syndrome, or SIDS for short.
Yeah. And how long are you typically with a client for?
So as I mentioned, we can follow them throughout their entire pregnancy, and then all the way up until their infant turns 3. And if they are postpartum, we can contact them after up to 6 weeks postpartum and continue to follow them. For our home visits, they're typically about an hour to 2 hours. And then it just really gives us enough and adequate time to really dig deep into the needs that those families may have. It allows us to get to know their families, the dads, any other children that they may have, and then also just help identify anything else that is not listed on our paper that we can help them with.
Yeah. That's cool. You almost like really integrate yourself into the family. I mean, obviously you're not like in the family,
right.
You know,
But we're
it's
definitely
cool.
part in some special way.
Yeah, that's amazing.
Yeah, and I know, here in April we have Black Maternal Health Week.
Yes.
It's a time, raising awareness about, as you mentioned previously, about the disparities that exist in health outcomes for people in that community. What's something maybe you want people to know about, specifically, thinking about Black Maternal Health Week? What's something you want people to know about that?
It's a crucial time to raise awareness about the disparities that Black women face in maternal health care. And it's also a time to just recognize those issues that I mentioned earlier, and also to just bring awareness that it doesn't just exist throughout 1 week, but it exists constantly. And the rates and the prevalence and the complaints and the risk factors are not changing. So I really want to amplify Black women's voices so that way they know that they can speak up if something doesn't feel wrong. They can ask questions. They can get the same exact care that they deserve.
Yeah. It's interesting. I was telling my husband last night that we were doing this recording today, and that it was like we're kind of doing it for Black Maternal Health Week. And he was like, "What's that?" And I was like, "Let me tell you. Let me educate you on why this is a thing."
Yes. It's a lot of people don't know about it or talk about it. I mean, my personal grandfather didn't even know anything about it, and he was like, "You guys are both women. What's the difference?" And I'm like, "Well, let me just pull out this. Let me show you these statistics." So yeah.
So like a fun question we like to ask a lot of our guests is sort of like a pageant question, if you will.
Never been in a pageant.
I know, me either, but I like to imagine it with like a pink dress and a tiara. Anyway, it's not about me right now. So the question was, if you could wave like a magic wand and change anything related to public health, what would it be and why?
What would I do? I mean, there are so many things that I would want to change.
Yeah.
We are not talking about statistics. We are talking about human lives.
Yeah.
And if I had a magic wand, I personally would make a healthcare system and some type of support system that is like truly equitable to everybody, regardless of their race, regardless of their background, regardless of their situation. I feel like healthcare, and honestly just healthcare and the well-being of an individual, should be a human right versus a financial burden or a fear or a stigma or a statistic. So I would try to make a magical building where everybody was welcome and everybody could be taken care of.
It sounds beautiful.
Yes.
That's great. That's really good.
Yes.
Okay, so Breana, I hate to do this here, but I think that this is, no better time than any, given that you and your team are the experts on safe sleep. Andrew and I have been working behind the scenes on a business venture together.
That's right.
Yeah, and it's a line of luxury cribs for babies,
Okay.
right? So just picture like the best thing that your baby could sleep in, and it's influenced by MTV Cribs and Pimp My Ride.
Okay.
So yeah, so I know what you're thinking. Where do I invest? We'll talk about that later. But for right now, I want to run just a couple of our models by you and see if they pass your safe sleep standards. All right.
Okay, I'm ready.
So first we have the Venetian. Now it's inspired by Italian accents, so a nice wood frame and everything, but with boat oars out the side. And that way, in case of flooding, it's got that going on. You got some boat oars, and then you've got like a little Italian pasta cooking station attached off to the side and everything. Yeah, so that way you can always you're taking care of the baby, and then you can have a little bit of pasta fazool, a little bit of
Babies get hungry a lot, right?
Babies do get hungry. Breana, what do you think from?
I would say no. Personally, I'm a messy cooker, so I would just imagine me splashing hot things or something happening on the baby. So I don't think that part is safe. And then what if the baby crawls out of the crib and just says, "Hey, there's a nice stove over here. Let me go play," or "Ooh, there's a boat oar for me."
You think that could be a problem?
I mean, a little.
Okay, hey, no, this is why we workshop ideas. That's tough, but
right.
we'll have to work that by quality standards.
Tough but fair.
Tough but fair. Here's another one for you.
Okay.
The Little Midas. Now this one, the Little Midas is a solid gold crib, all right? And hear me out.
Okay.
Chrome spinners for wheels. Now, the chrome spinners, they look great. You can upgrade for an underlight option should the baby want or need that.
Okay.
And then there's also a flat screen TV attached with a DVD player, preloaded, by the way, with a copy of Fast and Furious Tokyo Drift. How are we feeling about that?
I don't think the flat screen TV or the DVD player is safe. I don't think all that needs to be in there. So I'm going to say no. Maybe take that part out. But as long as it can have the spinners as long as it just stays still and you have a flat surface.
What if you projected the screen onto the ceiling or something? Would that be a little bit safer?
What if it falls?
Well, I mean, not that you wouldn't have the projector right above the crib, maybe off to the side and it just at an angle. I don't know.
Innovative.
Yeah, we got to have some innovation, really.
Innovative.
Yeah.
Synergy.
I think if it's off in a distance and it's not accessible to the baby, I think it would definitely be safe. Again, without the flat screen or the DVD player preloaded.
So let me get this straight. So we could, in theory, do the solid gold plated crib with the spinners as long as the baby has a nice firm mattress and they follow the ABCs of a lone back crib, right?
Yes. Nothing in that crib. No.
I think this business is going to succeed now.
I think so.
Yeah.
I think we got something to go with.
I think you need to be brought in.
Oh. We'll see what happens.
That's a great tacit rejection.
Just being very nice.
That's the nicest rejection I've ever. And look at me. You can tell. I've experienced rejection.
Stop.
Thank you so much, Breana. That was great.
Breana Francis. She is the public health nurse supervisor here at Franklin County Public Health. Thank you so much for coming on the podcast with us.
Thank you. Thank you so much for having me.
This episode of Health is Real is brought to you by trees. They help us breathe.
That's right. No one would be able to breathe without the wonderful, sweet-smelling, beautiful trees and plants that cover our community. They're...
Excuse me. Hello, this is Rodney the robot, and I'm here to tell you that robots do not need this oxygen you humans need. Therefore, I have no need for the trees and plants that supply it.
Well, think of all the other benefits of trees. They reduce stormwater runoff, which can help prevent flooding and reduce pollution in waterways, and they're a habitat for wildlife.
They also help reduce energy usage, combat climate change, provide opportunities for recreation, medicines, building materials, you name it.
Plus, tree canopy can cool down a city by up to 10 degrees by shading our homes and streets. That'll help keep robots like you from overheating.
Indeed. I must recalculate my opinion on trees and plants. Carry on with your tree promotional activities.
Trees, they're good for people and robots everywhere. Best restaurant motto. It's got to be when you're here, your family, Olive Garden, right? I mean,
Yeah.
that's so good.
I mean, that's
it's wholesome. You feel included. It has a sense of community in it, you know? And it's just great. What was Applebee's or what is, I guess,
eating good in the neighborhood.
Yeah. Hey, that's a good one. That's a
All
good-
right. Let me.
Oh,
let
is
me-
this going to be a quiz?
Well, I don't know. We're going for it. All right. So I'm going to tell you the restaurant, and you tell me what slogan you can remember. From
Or
it.
you can tell me the slogan and I have to guess the restaurant. That'd probably be easier.
That would be easier. We'll do it that way. All right. Finger licking good.
Chicken? KFC chicken?
KFC.
Hey.
Let me find the sound effect. You'd think I would have it closer at hand than I do. There we go. But it's worth it. It's
Yeah,
worth it
no,
in the end.
absolutely.
Anyway,
Anyway.
the next one, I'm loving it. That's an easy one. I'm loving it.
Popeyes. No. Oh, God. Wait, what?
Ba-da-ba-ba-ba.
I hear it in my head. I don't know.
It's McDonald's.
Oh. Where did Popeyes come from? Yeah. No.
Popeyes. I'm loving it.
I do love Popeyes.
I do too.
We
I mean,
can't
that
say
would be
this
a
on a
good-
health podcast, Andrew.
In moderation,
In
you can like other things that aren't maybe the best for you, but you want to always eat healthy too.
Yeah.
And with that said, next on our list of foods that probably shouldn't be eaten all that often, eat fresh. Eat fresh.
That's too short. I have no information. That's 2
Oh,
words.
there was a big advertising campaign for this.
No,
one.
I mean, no, I don't know.
Do eat fresh.
What? Thank you for singing it for me. It didn't help though. I don't know.
Subway.
Oh, you
I
know
mean-
what?
What?
It really irritates me that their $5 footlongs are no longer $5.
Absolutely. I've been seeing a lot of people who are also upset with that.
It's just
I've
not
also-
right. It's just not right. I mean, you can't put that much money in. Like, they advertised that so well, and it was such a great deal.
It was too good of a marketing campaign.
It was too
because
good.
it worked so well, and then they realized, we're not making any money off this. So then they had to raise their price, or had to quote unquote raise their prices.
Yeah.
And now people can't get it out of their head like, oh, it must be $5 for a
And
foot
it's
long.
not.
And it's not.
You just walk in there and you just leave full of disappointment with no
Yep.
sandwich in hand because
Yep.
it's so expensive now. Ah, crazy.
All right, next up, think outside the bun.
Burger King? Oh gosh, this is
It's
bad.
not a burger place. That's why you're thinking outside the bun.
Oh.
Taco Bell.
Oh. I thought that had something to do with a bell.
Yo Quiero Taco Bell was one from back in the day. They had the little chihuahua in the commercials.
Oh my god, my
would
dog
say.
was so cute.
Yeah.
Okay, but again, their logo is a bell.
Mm-hmm.
And what does the bell have to do with anything? Like they're not.
I don't know.
I feel like they could have come up with something that played on the bell. You know what I mean?
Maybe, but I remember think outside the bun was, and these may not all be like current.
Sure,
ones because marketing it changes.
It
over
always
time.
changes. Again, though, the bell. I'm just kidding.
The next one is I wouldn't get this next one, but maybe you will. It's burgers, fries, shakes.
Steak and Shake?
That's a really good guess. It's Shake Shack. Close, very close.
That was my second guess.
very close.
The shake really gave it away, you know?
How about an easy one though next? And I'm going to build it up.
Is it gonna be
Oh,
easy?
it's the easiest
I'm
one.
not going to get it. I can already feel it.
I just want to milk that. Okay, we have the meats.
Arby's.
There you go.
Hey. Okay, so the reason I think I got that though is they've stuck with that for a long time. They've done a
have.
lot of plays on it, like little offshoots to different areas. I don't know. Like they just have had offshoots, but it's always been
We have the meats.
yeah. Oh, I can hear it in my head. Amazing. That's good marketing.
All right, the next one I think it will depend how I say it. So I'm going to say it the way.
Can you sing it?
No, I will do my best.
Okay.
I think you'll be able to get it.
We'll see.
Pizza.
Oh, Little Caesars.
Got it.
Nice.
Got it. All right, the next one, maybe a little tricky. It's the sauce. It's the sauce. I've not heard this one really before. It does make sense for the restaurant, though. If you think about a restaurant where sauce is a big thing.
Taco Bell. Just kidding. We already did that one. Where sauce is important?
Mm-hmm.
I mean, everywhere, if you ask me.
Sauce is a vital part of this
No,
restaurant.
I don't have any.
Buffalo Wild Wings. Brings sauce
sure,
on wings.
Sure. Yeah.
All right. Taste the difference. I wouldn't know this one.
Taste the difference?
There's something different about how they prepare their burgers. That was a clue.
Burger King. Dang it. I keep guessing Burger. I'm going to keep guessing Burger King until I get it right.
You keep doing that. It's Wendy's.
Oh.
Their
What do
burgers-
they do differently?
Their burgers were square.
How can you taste the difference in a shape? Please tell me.
You can't taste shapes? Maybe that's a me problem. Okay. One more, and I find it highly unlikely that you would get it, but who knows?
Maybe I will.
A cut above the rest.
So not Burger King.
You can guess Burger King if you want. It's up to you.
A cut above the rest. First off, that's very arrogant of them.
Yeah.
I'm just trying to think of places I haven't guessed yet. Burger King. Just kidding.
Nope. It's actually Outback Steakhouse.
Oh, like cuts of meat.
I think that's what they were going for. But it doesn't really work.
You know, for a place that's known for their bloomin' onions, that seems like a missed opportunity.
Bloomin' onions.
Bloomin' onions. Yeah.
I have a
no.
bonus question.
Oh, okay.
Have it your way. Come on. Have it your way.
I don't know.
Oh, come on.
I really don't know.
That one's Burger King.
Oh!
I was trying to help you.
The one I kept guessing.
It wasn't even on the list. I just came up with it to give you one. Well,
Dang it. Well, thanks for trying.
it's all good.
Clearly, I don't actually go to Burger King.
Well,
You know, I'm
this
surprised.
is not an ad for Burger King, that's for sure. We don't know your slogan, and we don't frequent
care.
your establishment.
We don't know and we don't want to know.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Let us know your thoughts at fcph@franklincountyohio.gov, and be sure to follow us on your favorite social media platforms. And did you know that we offer vaccine clinics and education throughout Franklin County for both children and adults? Talk to a public health nurse to ask questions or schedule your vaccine appointment by calling us at 614-525-3719 or email shots@franklincountyohio.gov.